Hello, I'm Dr. Katherine Himes. I'm a fellowship-trained urogynecologist here at Virginia Beach OBGYN. A significant number of women experience bladder problems. A common condition is called overactive bladder, or OAB. This affects 15% of women of all ages. This complex condition occurs when one experiences sudden urges to urinate and the fear of leaking before reaching the bathroom. They may complain of frequently needing to empty their bladder. 2/3 of women with urgency and frequency will also experience bladder leakage before reaching the bathroom. These symptoms may occur because of medical issues like infections, kidney stones, or side effects of medications. However, most of the time, this condition occurs without an identified cause. At Virginia Beach OBGYN, our urogynecology team is here to help evaluate your situation. Oftentimes, the diagnosis is completed with a history and physical exam. Sometimes, additional complex testing is needed. This condition can be very distressing for patients. Fear of accidents and not being able to find a bathroom can negatively affect one's quality of life. It's important to know that there are treatment options to greatly reduce these symptoms.
Hello, my name is Dr. Mary Burns. I am a board-certified fellowship-trained urogynecologist at Virginia Beach OBGYN. Non-surgical options for overactive bladder involve dietary modifications such as reducing caffeine intake. It is important to review fluid management, and we often do this with bladder intake diaries. We are often able to help patients make simple changes that dramatically improve daily quality of life. Here at Virginia Beach OBGYN, we offer a physical therapy program called UroStem. This is a weekly therapy for typically 1 to 2 months where we use techniques called biofeedback and electrical stimulation to help evaluate one's muscle strength and endurance, as well as to help properly isolate and exercise pelvic floor muscles. In our practice, success rates have been very high. Medications have been available for years and have been found to be effective. It is important, however, for your doctor to review your medical history, as these drugs may have certain side effects and drug interactions.
For some women, these options may not be the answer. For those, there are 3 excellent procedures that we offer. Injection of botulinum toxin, commonly called Botox, when placed directly into the bladder wall, decreases the spasms of the bladder wall muscle. This procedure only takes a few minutes and can be performed in the office or in an ambulatory center. Typically, patients have minimal recovery and will experience improvement in less than 2 weeks. This procedure is usually repeated every 6 to 12 months, and this is a highly effective procedure for overactive bladder. The second option is an office-based intervention called percutaneous tibial nerve stimulation, or PTNS. PTNS involves using a thin acupuncture-like needle inserted through the skin above the ankle to stimulate the nerve that comes from the pelvis through gentle electrical impulses. This 30-minute procedure is performed weekly in the office for 3 months. It may take up to 8 weeks to see effect, but research demonstrates significant improvement in overactive bladder symptoms with this therapy. The third option, sacral neuromodulation, is a more direct way of stimulating the nerves that innervate the bladder. Research studies have shown this therapy is effective for patients with overactive bladder and/or urinary retention. This is also indicated for patients with accidental bowel leakage. The third sacral nerve is located near the tailbone and controls the bladder, bowel, and pelvic floor muscles. Sacral neuromodulation helps to restore normal bladder and bowel function by gently controlling the pelvic nerves. This therapy is delivered through a small stimulator that's placed under the skin just above the buttocks. This is a permanent procedure, but is easily reversible if needed. We want to reassure you that if you have overactive bladder, our Urogyne team here at Virginia Beach OBGYN will be happy to discuss options with you. Urinary incontinence is not a normal part of aging, and you can take actions to improve your symptoms.